Hi, my name is Andrew, and I want to thank you for taking the time to watch this presentation about marijuana. This is a giant topic, and it's one that encompasses a lot of different social, cultural, economic, and legislative implications for legalization of both adult use and medical use of marijuana. So what I've tried to do is kind of boil it down to some of the things that I feel like are most relevant for educating us and also to kind of get an idea of the scope of the marijuana industry currently right now. So we're going to look at what's happening with the legalization of marijuana and medical use marijuana. What are the economic implications of increasing use of marijuana? What are the social implications? How is legalization of marijuana affecting adolescents? Also, what is the role of medical and legalized marijuana in the opioid crisis, and kind of where is this going for the future? So, first thing is currently, when you take a look at the United States over here, we notice that there are 47 states which have legalized marijuana use in some form. There are 11 states plus the District of Columbia, which has legalized recreational use for adults, and there are 22 states that have given patients access to medical marijuana. 14 states are CBD only, which is the non-psychoactive component of the plant. So with such access to cannabis, there are 223 million people, or about 98.6% of the US population, that is currently living in a state with some form of legalized access to marijuana. There is about 3.7 million current medical marijuana patients within the US. So that makes up a large portion of just the entire medical community using marijuana right now. And as we can see with this graph showing the Senate seats and the House seats, the biggest thing to take away from that is there is a lot of federalized support for legalization of marijuana in some facet, whether it's adult use for recreational or medical use or CBD only. There is still a lot of support for it, but the current federal government has not figured out quite how to address that yet. So what are some of the economic implications of the legalization of marijuana? Marijuana is a massive industry. This is a multi-billion dollar industry, and in 2018, the cannabis industry generated $10.3 billion in consumer sales, and is projected to reach $13.6 billion by the end of this year. The total legal sales are continually growing at a compounded annual rate of about 14%, and it's projected that over the next 5 years, in 2025, that the legal consumer cannabis industry is going to be producing about $30 billion in consumer sales. Now, if we look at the graph that is up above everything in the maroon line, you can see that even legalized adult use and legal medical markets make up a small portion of what the entire illicit market of cannabis is. There's a giant demand for the use of marijuana. And what this demand looks like is there's about 29.9 million pounds of marijuana that's currently being grown both illegally and legally to help supply the industry. Most of this comes from California. California makes up 58% of all the cultivation of marijuana, which is producing about 17.3 million pounds. So there's a giant revenue that's being put into the infrastructure of the United States due to this. And so we need a lot of workers to be able to help facilitate different transactions, the businesses working in the marijuana shops. And so currently, based on just some form of legalized or medical marijuana within the industry, By 2020, there's expected to be 425,000 jobs associated with the cannabis revenue generation. And if the government was to say, hey, you know what, we're going to just open up legalized marijuana to the entire United States, there's an estimated 1.63 million jobs that could potentially be gained due to the marijuana industry. Though it's really kind of difficult to track exactly the specific job metrics of how many jobs are needed, there is currently, through sites like ZipRecruiter and Indeed, they're reporting between 200,000 and 300,000 jobs within the marijuana market nationwide. And Glassdoor, which is also another recruiter for jobs, they reported 76% increase in cannabis job openings just this year. So there's obviously a massive economic cost being generated in the US economy for some form of marijuana use. And the social implications of legalization are difficult to extract just due to the relatively short period of time to just gather longitudinal information about affecting different populations of people and how this is affecting communities and such. Most of the research conducted has been from the state of Washington and Colorado, which both legalized marijuana in 2012 for recreational use of adults for those that are 21 and over. Additionally, in 2014, Alaska, Oregon, and the District of Columbia in Washington, D.C. Legalized marijuana use for adults. And so there's been a lot more comparative data that can start to show trends of the social implications of use. Overall, public support is very high for the use of some form of legalized marijuana in the U.S. It's at about 64% right now. And out of the U.S. voters, there's currently 75% of voters who are in favor of some form of legalized access to marijuana, whether that's medicinal or for full-on recreational use for adults. So as I mentioned with the economics earlier, there's all this money that's coming into the economy right now. And so we have this giant taxation revenue that's taking place. So marijuana sales have generated almost $600 million for the state of Colorado since it began completely funding sales within the state in 2014. And the state has distributed $230 million to the Colorado Department of Education between 2015 and 2017 to help fund school constructions, early literacy programs, to help with bullying prevention, and also behavioral health programs. Oregon similarly has allocated 40% of its marijuana tax revenue to fund the state schools, and has also put so far $34 million just into a general education fund. The state of Nevada is also projected to bring in $56 million over the next couple of years that will help fund schools as well. So school and education is just a massive thing that a lot of the revenue from taxes are being used for. But besides that, state alcohol and drug treatment funds are also the next biggest beneficiaries. Oregon, for example, is distributing 20% to alcohol and drug treatment, and Washington has dedicated 25% to substance use disorders and treatment and education and prevention. The other thing with Washington as well is it's distributing 55% of its marijuana tax revenues back into basic health plans. So this is going to be helping out the people living there with medical expenses. Continually, California as well, they've put 60% into a youth treatment fund. And the thing as well that California has done is they put 20% back into environmental restoration. Because of the illegal market of marijuana, a lot of the cultivation has been taking place on public lands. And therefore, a lot of public lands have been fairly destroyed due to either the cartels bringing in massive amounts of fertilizers and also just all the plumbing that needs to take place to grow such vast quantities of marijuana, that a lot of the public lands are really suffering due to the implications of illegal growing operations on public lands. So they're trying to reinvest at least 20% of this taxation revenue into environmental land restoration once again. The big thing is like, what does this look like for adolescents? As soon as recreational and legal medical use of marijuana took off, people were really concerned about what does this look like for adolescents. There was a lot of people afraid that there was going to be a drastic spike in the use of adolescents with marijuana. But what numerous studies have confirmed is that adolescent use of marijuana has remained constant and has even shown a slight decline in states that have legalized cannabis use for recreational and medicinal purposes. From a study from Hall and Lineski in 2016, states which passed medical marijuana laws had higher rates of 30-day cannabis use before laws were passed than states that did not have some form of legalized law. Also, from the economic social costs of legalization of marijuana in 2018, they found that recreational marijuana legalization has no impact on juvenile marijuana possession arrests, which is consistent with previous findings that medical marijuana legalization does not lead to increased marijuana consumption amongst teenagers. And most recently, in September 2019, the Journal of American Medical Association of Pediatrics, they too concluded that there was no evidence that the legalization of medical marijuana encourages marijuana use amongst the youth. This is concurrent with all the research that's been taking place so far, showing that there has not been a significant increase in adolescent usage. The one thing that is concerning was from this study that Serta et al. Did in 2018, which presented national evidence on the impact of enacting legal medical marijuana laws, what that had on the use of marijuana for adolescents for usage, binge drinking, using cigarettes, non-medical prescription drug use, and illicit drug use. And they looked at this amongst 8th graders, 10th graders, and 12th graders. What they found was that amongst 8th graders, that essentially there was a decrease in usage after medical marijuana legalization was enacted. Similarly, amongst 10th graders, they found that there was no change after medical marijuana legalization. But the frightening thing is that amongst 12th graders, non-medical prescription opioid and cigarette use increased after medical marijuana legalization, but no increase use of marijuana. So they were very distraught by that last bit of data, and this was something that they were planning on digging into for future studies.